Welcome. Today, we are diving deep into cystic kidney disease. We're going to break down what it really means when cysts show up on the kidneys, looking at everything from a really common, simple finding all the way to a complex genetic condition. Let's get right into it.
So picture this. You go in for a scan for something totally unrelated, and the doctor comes back and says, well, we found something on your kidney. It's a cyst. It's a scenario that honestly happens way more often than you probably think. And, these little fluid-filled sacs are often just harmless discoveries, especially as we get a bit older. But the very first and most critical step is to figure out exactly what kind of cyst it is, because that one detail changes everything that comes next. Okay, so our investigation is going to start with the most common scenario, finding a single cyst. And right off the bat, we have to make a big distinction between two main categories, the simple ones and the complex ones.
A simple cyst is pretty much what it sounds like. It's a smooth, thin-walled bubble filled with clear fluid. On an ultrasound, it just looks like a dark spot because the sound waves shoot right through it. That's what doctors are talking about when they say anechoic. And almost all the time, these are completely harmless, often just a sign of aging.
So the key differences doctors are looking for are all about the structure. A simple cyst, on one hand, is smooth and thin-walled. A complex cyst, on the other hand, well, it often has these thick, irregular walls. And instead of just clear fluid, it might have other stuff, other material inside. That's what really raises a red flag and tells them they need to look closer.
Let's really break down what those red flags are. Doctors look for things called septations, which are basically thin little walls dividing the cyst on the inside. They also check for calcifications. Think of these as tiny, hard calcium deposits. And here's a really crucial one. During a CT scan with contrast dye, they watch to see if the cyst enhances. In other words, does it light up? Because if it does, that enhancement means it has its own blood supply, and that is a major, major concern.
So, why do all these little details matter so much? Well, while a cyst can become complex because of something like an infection or some bleeding, the number one worry, the main concern, is the potential for malignancy. Doctors have to rule out renal cell carcinoma, a type of kidney cancer, because those red flags we just talked about can absolutely be signs that it's there. All right, let's totally switch gears now and talk about a completely different scenario. In this case, we're not talking about just one or two cysts. We're talking about a condition that completely transforms the entire kidney. This is polycystic kidney disease, or PKD, and with this condition, the kidneys literally get overwhelmed with cysts. It causes them to grow to a massive size, and over time, they just lose their ability to function. At its core, PKD is a genetic disorder. It's inherited, it almost always affects both kidneys, and the relentless, nonstop growth of these cysts eventually crowds out and just destroys all the healthy kidney tissue around them. Now, it's really important to know that PKD isn't just one single disease. There are actually two main forms. The adult type, ADPKD, is way more common. It's autosomal dominant, which basically means you only need to inherit one copy of the faulty gene from a parent. It usually starts showing up when a person is in their 30s or 40s. Then there's the infant form, ARPKD. It's rare, but much, much more severe. And it's autosomal recessive, meaning a child has to inherit the faulty gene from both parents. So what's happening on a genetic level? Well, you can think of it as a problem with specific proteins. These proteins are like the traffic cops for cell growth inside the kidneys. In the adult form, ADPKD, a genetic mutation messes up the polycystin proteins. In the infant form, it's a totally different gene affecting a protein called fibrocystin. But in both cases, when these protein traffic cops aren't doing their job, cell growth just goes wild, and that leads to the formation of countless cysts.
So why is having hundreds of these cysts so dangerous? It's not just about the kidneys. This disease creates a massive ripple effect of major health problems all through the body.
In adults, you have these constantly growing cysts that are just squeezing and compressing healthy kidney tissue and all the blood vessels. This leads to chronic kidney disease and, for a lot of people, eventual kidney failure. It also causes really severe high blood pressure. And because those faulty proteins are found in other places in the body, cysts can also form in the liver and the pancreas. And, most dangerously, the blood vessels in the brain can become weak.
And that leads us to the single most dangerous risk for people with ADPKD, the formation of what are called berry aneurysms. These are weak spots that bulge out in the brain's blood vessels. If one of those were to rupture, it causes a truly devastating type of stroke from bleeding all around the brain. And this is exactly why screening is so incredibly important, especially for those who have a family history of it. Now, for infants with ARPKD, the story is tragically different, and it starts unfolding even before they're born. Their kidneys start to fail in the womb, which means they can't produce enough urine. And since fetal urine is the main ingredient of amniotic fluid, the fluid levels around the baby drop. Without that cushion of fluid to support their development, the baby's lungs just can't grow properly. And what that all means is that for these infants, the most immediate, life-threatening crisis isn't actually kidney failure, it's lung failure. They are often born literally unable to breathe on their own, and this becomes the biggest hurdle to their survival. Okay, so how do doctors figure all this out and then create a plan to manage these conditions? Let's take a look at how it all comes together. For pretty much any suspected cyst, the first and best tool in the box is an ultrasound. It's totally non-invasive, and it's fantastic at showing the basic structure. Now, if a cyst looks complex on that ultrasound, the next step is usually a CT scan with contrast. That gives a much more detailed picture of its features and, crucially, its blood supply. To make sure everyone is on the same page when dealing with complex cysts, doctors use a system called the Bosniak classification. It's a way of ranking cysts based on how they look. Categories I and II are considered very low risk, basically nothing to worry about. Category IF, and that F stands for follow-up, are watched over time with more imaging. But for the most complex cysts, categories 3 and 4, the risk of cancer is just so high that surgical removal is often what's recommended. Managing the adult form of PKD is a lifelong marathon, not a sprint. The goals are to be really aggressive about controlling blood pressure to protect the kidneys. Use specific medications like tolvaptan to try and slow down how fast the cysts grow, screen for those dangerous brain aneurysms, and ultimately prepare for either dialysis or a kidney transplant when the kidneys eventually fail. For infants with that severe recessive form, treatment is all about support. The number one priority right away is managing the respiratory failure, which often means they need a mechanical ventilator to breathe. After that, the focus shifts to controlling their severe high blood pressure and the progressive liver problems that also come along with the disease. Okay, we've covered a ton of ground here, from a random finding on a scan all the way to a devastating genetic disease. So, what's the single most important message you should really take away from all of this? It's really this: not all cysts are the same. The word cyst can describe a totally harmless mark of aging, or it can be the very first sign of a life-altering condition. And that's why getting a precise diagnosis, telling the simple from the complex, and the isolated from the systemic is without a doubt the most powerful and important first step.